Hi, Derek. This is Paula here. We have you unmuted in case Scott Livingstone or Minister Merriman call on you. So if you could just keep your line quiet, and then if they call on you, go ahead and respond.
Livingstone provide a COVID vaccine rollout update in 2 minutes. Thank you. Hello, everyone. Thank you so much for taking the time to join us. From the Legislative Building in Regina, we have Health Minister Paul Merriman, SHA CEO Scott Livingstone, and on the line we have Saskatchewan's Chief Medical Health Officer, Dr. Saqib Shahab. We'll start with opening comments and then move to questions.
Thank you. Good afternoon, and thanks for joining us today. Today we are announcing more details about the next phase of our COVID-19 immunization plan. As you know, we are currently still in phase 1, which covers priority healthcare workers, residents and long-term care staff, and other Saskatchewan residents over the age of 70. Phase 2 will be our mass vaccination stage. It's going to begin hopefully sometime in April, depending on the number of doses that we receive in the coming weeks from the federal government. Our goal will be to vaccinate as many people as possible, as quickly as possible, and to do so in a way that reduces severe outcomes as much as possible. For that reason, we will be focusing on age as the primary risk factor. We know that age is the #1 factor in determining severe outcomes from COVID-19. So our mass vaccination will be done by age, starting with our oldest residents first. Right now we are in phase 1, which includes everyone over the age of 70. In phase 2, we will be vaccinating people over 60, then people over 50, and so on, until everybody that wants to be vaccinated can be. There will be a few additional groups prioritized, like clinically extremely vulnerable individuals, and people in some congregate living settings, like emergency shelters and group homes. But like most other provinces, we are organizing our mass vaccination program primarily on age, because that's the best way to get things done for the most people the quickest. And that's the best way to reduce severe outcomes. There will be hundreds of locations in Saskatchewan to get vaccinated: public health clinics, drive-through clinics, mobile clinics, pharmacies. We are taking an all-hands-on-deck approach that will allow us to do thousands of shots a day. Saskatchewan currently has the highest percentage of our vaccine supply in people's arm over any other province in Canada. And we have delivered the second highest number of shots per capita, only behind PEI. Of course, as you know, we are still very limited by the scarce supply of vaccines that we are currently receiving from the government. This week, we expect to receive fewer than 2,000 doses here in Saskatchewan. To date, we have received 45,000 doses. There are about 190,000 people in our phase 1. And as a 2-dose vaccine, that's 380,000 shots. That means, so far, we have only been able to do 12% of the people identified in phase 1. The federal government has assured us that vaccine shipments are going to start picking up next week, and we will continue to increase up to March in the second quarter of this year. But it could be sometime in April before we get to phase 2. But Saskatchewan is ready for this. We just need some more vaccines, and they can't get here soon enough. Once again, I'd like to encourage everyone to get vaccinated when it's your turn. That's how we will protect ourselves and those around us. This is how we will get through this pandemic and get back to a normal life. With that, I'll turn things over to Scott Livingstone to present the details of our mass vaccination.
Thanks, Minister. So just before I start with the slide deck, I want to make sure folks know that our Chief of Emergency Operations Center, Mr. Derek Miller, is also on the line for questions after the presentation. And I'd like to start with a few opening remarks. I'd like to start by passing on our sincere condolences to families of those who've lost a loved one due to COVID-19 over the last week. I'd also like to take a moment again to acknowledge our healthcare workers across the province. As you know, the hospitalizations and fatalities from COVID, which are a lagging measure of cases, continue to be high in our province. This is not just taking a toll on our families across the province, but also our care providers as well. We know that the staff face public, our staff who are working with the public across the province are fatigued, just like our public members are. And there's an increasing number of stories, again, of healthcare workers being treated disrespectfully for just doing their jobs, trying to protect people across this province from the COVID-19 virus. So again, we need your support to help support our healthcare workers, physicians across this province that are taking extra precautions to keep everyone safe. The vaccine represents our most, the tool that we will need to slow down this pandemic and benefit our province. And as you heard from the minister, we will do that in a way that is broad and high volume and vaccinates everyone in this province as quickly as possible. And I'm going to get into the slide deck in a minute, but I just want to make sure that everyone knows that there will be time for questions after the fact. And certainly, I believe both the slide deck and the immunization plan are available to, it's been made available to media, but also available online for those who are interested. So just to start with the immunization plan. There we go. I'd like to start with our goals. So first of all, just to remind folks of our goals, which are very similar to the overall goals that we started with as we began this pandemic and trying to contain, mitigate, and delay the virus. But it is certainly the goals of the immunization program is to protect those most high risk and vulnerable, minimize serious illness and death, protect the capacity of our healthcare system, minimize the spread of COVID-19, and of course to vaccinate as many people as possible as quickly as possible. So just to highlight some of the things the minister said about our vaccine plan, and we did share some of these details at a higher level previously, but Saskatchewan's COVID-19 immunization delivery plan is built on the foundation that age is the main risk factor associated with COVID morbidity and mortality. As you know, phase 1 is still targeted on vaccinating our high-risk populations, those in long-term care, personal care homes, people of advanced age, and healthcare workers that have also been identified as a priority. In phase 2, the main focus of vaccinating the general population will be age, as well as the minister has pointed out, extremely vulnerable individuals and those in emergency shelters and group homes. Focusing on age is the primary, because it's the primary risk factor, will enable Saskatchewan to receive COVID-19 vaccine as quickly as possible and in most efficiently and time-effective manner. I think you've all seen components of this in the early on, but just to highlight phase 1, where I've said we're focusing on long-term care. As the minister pointed out, that represents about 190,000 people across this province and 380,000 doses of vaccine. As you've been tracking, I think today we're close to 45,000 vaccines have been delivered. So we're nowhere near our target goal in phase 1, and that is primarily or almost exclusively due to the fact that we haven't received vaccine to deliver. And that will continue to be a challenge for us without knowing what vaccine is coming past Q1 of this year. Phase 2 has also been outlined, will be done in 10-year age increments, and they're on the slide, going from 60 to 69 down to our 18 and 16-year-olds to 29-year-olds. And at the same time, those vulnerable populations will be fit in under the first phase of the age-based criteria for 60 and 69-year-olds when phase 2 starts. And again, that is 100% dependent on us receiving vaccine to do so. Just a couple of comments about vaccine supply. The Government of Canada, as you know, is committed that every Canadian who wants to be vaccinated will be vaccinated by September of 2021. To meet that deadline, the Government of Canada had originally announced that it had secured 6 million doses of the vaccine, both for Pfizer and Moderna combined, to be delivered in Q1 of 2021. Of that supply, Saskatchewan was expecting to receive 191,000 plus doses of the vaccine, and the distribution by manufacturers on the bottom of the slide, 124,800 for Pfizer, 65,500 doses of Moderna. The team that's responsible for the Immunize program, as you can imagine, has had to pivot multiple times over the last 4 to 6 weeks because of information that's coming to them in real time on a weekly basis with respect to delays in vaccine supplies or vaccine not showing up as expected. And this has been part of the challenge in getting things moving, but certainly, for us, the big challenge is how do you give people vaccine when there's none to give? So we also are anticipating, as you know, 12,600 doses of Pfizer not to arrive in Q1 and 500 less doses of the Moderna vaccine as well. The current allotments that we have are less than half of what our phase 1 priority population requires to be fully vaccinated. And we continue to see delays in receiving vaccine, and those delays are going to extend the time it will take us to finish phase 1, but also may disrupt our start of phase 2, depending upon how much vaccine we receive near the end of March and in early April. Future amounts of vaccine, as you know, through the Public Health Agency of Canada, they have not provided us with confirmed allocations below Q1. So from a planning perspective, and what you'll see in the plan is a plan that predicts us getting as much vaccine as we can, as quickly as we can, and a delivery plan to get that in the arms of people in this province as quickly as possible. The phase 2 plan, again, just to highlight, we hope to start in April and still plan to start in April, but that may be pushed out depending, again, on vaccine supply. And the finish point of the vaccination program is also going to be dependent upon vaccine, but also on things like vaccine uptake. And it's important to understand that once you are eligible to receive the vaccine, for example, in phase 1, you are eligible at any time throughout the immunization program to receive that vaccine. So if you're part of the phase 1 group and you've made a choice for whatever reason not to be vaccinated, you can always be booked in at any time through the immunization program to receive your vaccine. It's not a one and done. It's a program that we're trying to make as flexible as possible so that people of this province can get vaccinated as quickly as they choose to be. The other thing to remember is within phase 2, beyond the age groups, and the populations are distributed as such in this slide, we will also giving a quantity of vaccine to targeted patients both in congregate living and those clinically vulnerable populations. And as I said before, they will be begun at the very first component of phase 2 in the 60 to 69 age group. So why are we focusing on age? And we've talked a lot about this throughout the pandemic, but I think this table is a good reality check, but also a good reminder of who's most vulnerable and who's most affected by this virus. And this certainly shows the deaths, the absolute worst outcome of this virus and how it has decimated the older population in our province. And it's why age is the primary factor involved in phase 2 vaccination. So this table, but also the vaccine plan, does go into some detail as well around who are those individuals. But just to give you an example, it's those individuals, as I said before, living in group homes. Sorry, I'm behind. Living in group homes, as well as those people with underlying health conditions that are extremely vulnerable. And that includes individuals on this list, but there are some others as well. But that clarity will be provided as phase 2 comes to fruition. But certainly those vulnerable populations in organ transplant, certain cancers, those with severe respiratory conditions, as well as the others listed here will be part of that group, as I said, starting with the 60 to 69-year age group following phase 1. So phase 2 clinics, to give you an idea of operationally what it looks like, is the Saskatchewan Health Authority is planning on operating more than 220 clinics across 180 communities in this province, and they'll have multiple different forms, including mass immunization clinics, drive-through, walk-up, and mobile clinics, as well as a number of community-based clinics and community support clinics that will include community-based pharmacies, physician offices. I'm going to get into a little more detail of that in a minute. So the table on the bottom gives you an idea of what the distribution looks like for mass immunization, the drive-through clinics and mobile clinics that the Saskatchewan Health Authority will operate. As I said before, there are 3 primary categories of the clinics. So by appointment, those public health clinics in our public health clinics across the province, our mass immunization clinics that will be brought up, as well as drive-through and walk-in. And then, of course, the community, and it does expand the list a little bit. It does include others other than community pharmacies who are so instrumental in delivering the flu vaccine in this province, but physicians' offices, partnership with community-based organizations like shelters, but also our First Nations communities and partners across the province will be involved as well. And it's important to understand that those community clinics are they're not counted in the 226 clinics. Those are over and above. So the next 8 slides give you a visual of how well distributed and how broadly distributed the types of clinics are across the province. So this slide shows the far north and the north. The red dots, green dots, and yellow dots represent the type of clinics. It's hard to see on this slide, but it is summarized in the table, the next table, which shows you that in the far north and north we'll be operating 89 clinics of multiple different types, making it as open as possible for people to receive their vaccine. Again, these tables don't include those community-based clinics that will be leveraging partners like community-based pharmacies in them, so there will actually be more distributed across the province. Next slide is, again, a map of central and southern Saskatchewan. Again, you see a large distribution of multiple types of clinics across the province. Again, the next slide will show you that it results in 108 different types of clinics. Again, these are SHA-operated clinics and don't include all the other community-based clinics, so we'll have more than that. But there is a substantive number that is well geographically distributed across the entire central and southern part of the provinces. Last but not least is Saskatoon area, where we see, a number of clinics outside of Saskatoon, but also inside of Saskatoon. And even though there's only 3 dots in Saskatoon representing the clinics, that doesn't mean there's going to be one of each. There'll be multiple clinics of each type available in Saskatoon and in Regina. So Regina being the next slide. So again, it's just highlighting that just because you're seeing 3 dots in Saskatoon and Regina, it doesn't mean there won't be multiple clinics. There will be multiple clinics, and including, this is where we have the majority of pharmacies in the province are actually located in the 2 biggest centers. So there'll be a broad swath of clinics available to patients. So if the next slide talks about some of those additional vaccine clinics that we'll be using, again, throughout rural, urban, and northern Saskatchewan. We are also looking at securing property so that we can use seasonal clinics in large parking lots and set up pop-up tents and do drive-through and walk-in clinics outside of the heat of a building in winter in Saskatchewan. So we are looking at how we can make vaccinations and immunizations more available to people throughout the province, looking at what we can do for seasonal. And then again, below that is where we define some of those clinics that we'll be using in the community to strengthen the response across the province. So again, going back to community pharmacies last year, 385 pharmacies in 113 different communities participated in our flu immunization program. They represented about 50% of the flu shots across this province, so they will be integral in supporting the work that we're doing. Next slide, Minister. So resourcing, so besides the actual location of the clinics and some of the support equipment that we need, tables, chairs, all that kind of stuff, and managing the logistics, the human resourcing of the clinics is a key and important component. We believe through the planning that we'll require more than 2,200 people involved in delivering the vaccine in phase 2, almost 700 healthcare workers being redeployed to deliver that vaccine, and then we'll also use a widespread deployment of other types of immunization resources, some that we typically use to do immunization, like public health nurses, but also a broader swath of health professionals to do that work for us, including EMS, medical students, nurse practitioners, the health staff on First Nations reserves, as well as retired healthcare workers. So there will be a broad swath of human resources supporting the immunization program across the province. So next slide. So how we're going to keep people informed, throughout this, we know that people want information. We'll be working hard to publicly communicate around when it's your time to be vaccinated, how to register for a vaccination appointment, what different types of immunization clinics are available to you, and where to find and how to find the closest one to you. All clinic and registration details will be available on the Saskatchewan.ca website. Information will also be included in other multi-forms, so local media, social media, ads, posters, direct mail, as well as news conferences. So just around how we've been managing phase 1 in booking an appointment, and to remind folks, For residents of long-term care and the staff, we have been contacting them directly and booking them in. For priority healthcare workers, they are contacted and are booking appointments. But with respect to the 70-plus living independently in the community who are waiting to hear from us, they will receive information through either direct contact from the SHA whenever possible, but also through local media and social media when direct contact is not possible, to ensure that they're getting their appointments as quickly as possible and booking them in. Within Phase 2 booking appointment, a couple of things that we're adding to support mass vaccination across the province is we're putting in an electronic scheduling system that will allow patients to book online and see what clinic appointments are available over the next, when clinics are available, so they'll be able to look at a calendar that says this is when I can book an appointment and what's available. There will also be a toll-free telephone line for those who don't want to book online that can phone and book an appointment through a dedicated call center. Both of those will be available early March, so they'll be available well in advance of Phase 2 starting. Last but not least, you've heard a lot in the news around proof of vaccination and what will be required for travel and all those sorts of things. So every resident of the province who receives vaccine will receive a vaccination record, paper record, identifying that they have been vaccinated against COVID-19, and they will also have an electronic record that can be accessed by them registering for My Sask Health Record. So there'll be two ways in which they'll be able to access their immunization verification record. And last but not least, I think we can open it up for questions if anybody has any questions about the plan.
All right. Thank you, Scott, and thank you, Minister. We'll start with questions in the room. Steph?
Yeah, we're still very much in the thick of the spread of COVID-19, and the actual start date for mass vaccinations is still a long ways off and very much up in the air. So are we not giving people a bit of a false sense of hope or security by talking so much about when they're going to be able to be vaccinated when we really don't even know when we're going to be able to begin this phase of it?
I'll maybe start off and get Scott to add into that. I've heard from a lot of people, they want to know what's going on. What is it going to look like? How are we going to be informed? And when can we get in? So we're trying to give them two out of the three of that. What is it going to look like with the mass vaccination clinics, the drive-thrus, and the also the mobile clinics? We're going to tell them how that they can do this. The when is a little bit out of our hands right now. Well, it's not a little bit, it's completely out of our hands. That's when the vaccination or the vaccines actually start flowing. We'll determine the when. So I've heard from lots of people that this is what they would like to be able to know how it's going to roll out, and we're trying to give them as much information with as much lead time as we can.
So the only thing that I would add is I don't think we can talk about vaccination enough and prepare people for what's coming, and particularly as we've seen across the world and also this country and here is people having vaccine hesitancy. And I think communicating about the safety of vaccine, communicating as much as we can about its availability. We are still in the throes of Phase 1, but we do need to prepare, just like we're preparing as an organization and with our partners, to be able to operationally deliver vaccine at a huge and enormous scale across this province. We need people to be ready and have made their decisions about, I'm prepared to get a vaccine and I've got my consent form and I'm waiting to get that booking next. So and finally, I would just add, that, and I talked about this, the only consistent thing around this entire pandemic that we know is change. And the teams have had to pivot so many times because of not knowing when vaccine is coming and not having definitive timeframes. But the reality is we have a safe vaccine. We have it inside of a 12-month period of time since the start of this, and we need to actually prepare the province and prepare the people of this province to receive that vaccine as quickly as possible.
Follow-up, Steph?
For either of you, under the current pace of deliveries, when are we looking like we might finish Phase 1 under currently what we are receiving?
If we received everything that was promised by the federal government, it would be looking like sometime in April. It's hard to pin that down right now, but that would be our hope that we can get started Phase 2 in that period of time.
But under currently what's happening, obviously, I've heard you raise lots of concerns that we're not getting what we need, and there's only like 10 or 12% of that 190,000 people. So currently, based on what we are receiving now, not what we were supposed to receive, when are we looking like we're going to finish that?
Again, I got to go with what the federal government is saying that is coming as far as vaccines, and I want to make it very clear, we're hopeful that the federal government can procure these vaccines and get them to us. We want to support them in that, because it gets us back to normal. The challenge is them actually getting to the ground. There's lots of commitments that the federal government has procured many vaccines and multiple vaccines, but we need them actually to arrive on the soil in Saskatchewan so we can get them into people's arms.
So the only other thing I would add is that although we've seen this delay, which is slowed us down in phase 1 and potentially is going to impact phase 2, what it also does is gives us time to create that all hands on deck and that vaccine ready every single place in the province. So once vaccine starts shipping, if it starts shipping in larger quantities than we expect, we'll be prepared to be able to deliver out to the people of this province at a quicker pace.
Arthur?
Can you explain why you didn't choose to put more priority in this sequence on to essential workers that are in frontline positions outside of the health system, so those who aren't able to stay home because of their jobs, like police officers, firefighters, other, kind of frontline workers?
Sure, I can start. This was the fastest way that we can get vaccines. When we start to look at separate groups, and I've heard from everybody. I've heard from all groups that are lobbying to be prioritized within the sequence. And they're all valid points. And I want to emphasize that. In saying that, what we're looking at right now is getting a large quantity of vaccines in a short amount of time. So the best way to distribute that and get it across our province as fast as possible and as safe as possible is to look at age categories. That's also where we've seen the attack rate of COVID, as was outlined in the presentation. It's the people that are over 60 that are unfortunately have the most impact from COVID and the most fatalities that we've seen in Saskatchewan and across the country and around the world. That's where we need to focus in to make sure that that group is immunized. That will take pressure off our healthcare system, and hopefully at some point we can start looking at what are the restrictions that we can do once that group is protected.
Follow-up?
Sure. So this is for either Minister Merriman or possibly Dr. Shahab. It's from my sports department, actually, and I do understand that the WHL has put in a proposal and is having discussions with public health officials to see if the league can proceed with a hub city, perhaps here in Regina. And I was wondering if you could see this proposal and where it is in potentially being approved.
I'll let Dr. Shahab touch on that one. He's the one that's directly involved with that. Dr. Shahab?
Yes, I'm sorry, I couldn't clearly hear the question. If someone could repeat that, I can't clearly hear the question from the room.
The question was just in regard to the discussions with the WHL and where we're at in terms of a hub city.
Also, discussions with WHO regarding?
The Western Hockey League?
Yeah, the Western Hockey League and potentially Regina being a hub city, Dr. Shahab.
Yeah, so those discussions are ongoing, and obviously major sports have already happened successfully through effective isolation of players from teams from each other except during play, and from teams from the surrounding community. So that hub model has been shown to be successful in a limited fashion across Canada, and that same model is being explored by the WHL. So we have given our recommendations to the WHL for a hub approach, and we are waiting their confirmation of the same.
Go to Mark.
Today the federal government approved a change to Pfizer vaccines labels to stipulate that they have 6 doses in them. How often has Saskatchewan been able to get 6 doses out of those vials from Pfizer?
So with Derek on the line, I'm going to rely on Derek, but Derek, do you know the answer to that question about how frequent we're getting 6 dose?
Yeah, Scott, it's, sorry, getting some echo. We typically get the 6th dose out of about every 10 to 20% of the time from each vial. Although it does vary, it varies based on the experience of the immunizer and other factors. We are anticipating the provision of the low dead space needle and syringe that will allow us to be able to consistently achieve that. And that will be very important to be able to realize that 6 dose consistently.
And maybe if I could just add to that is we've always said that 5 doses was the norm and the 6 dose was a benefit dose that we were getting. And we got those out of our first 1,950 doses that arrived in Regina. And it was great to be able to extract those other ones out because we had done our scheduling on that. Now with the 6 dose and not being consistent all of the time, it's going to create some challenges as far as scheduling and as far as many doses that we can administer in a day.
Follow-up, Mark?
Yeah, on a different topic, since students and teachers returned to the classroom after the holidays, we've seen a high number of cases in schools. Is the province considering using some rapid testing to proactively look for COVID-19 cases in schools?
Yeah, I would certainly, first off, I want to thank the teachers and the education system. They've done an amazing job with the children, and the children have done an amazing job in adapting to a very challenging year. As far as that, we're considering moving out some of our point-of-care testing to the education. We do have to have people trained to be able to do it. There is some training requirements, so we're looking at, are the nurses involved that are in the school system? Can they be engaged, or can we provide some other support in there for them to be able to do some testing? But overall, the education system has done an amazing job of keeping COVID out of the schools, and when it does come into the schools, it's contained and managed extremely well.
And we'll take some questions on the line. Operator?
We have Adam Hunter with CBC.
Thanks. There have been some questions from people that are currently in phase 1 about when they'll be contacted, how they can sign up. A lot of these people obviously are elderly and may not be online and those sorts of things. So what can you tell them to let them know with some certainty of how they're being contacted and when they'll be able to receive their vaccine?
So, Adam, in the presentation and what we've been doing is we'll be contacting them directly, so telephoning 70 plus across the province to bring them in. We also, in smaller communities, if we can't get a hold of people directly, we have physicians and other members of the community that are helping us gather folks up, but we will also use radio ads, social media, and other things to make people aware that it's now open for 70 plus in their communities. I can tell you that we're in a small group of folks where we did open it up in phase 1 where we had vaccine available. We didn't have a problem with people knowing that they were eligible for the vaccine. But we will continue to look at every opportunity to contact those folks and let them know. I know they're anxious. I've had calls from many of them, and right now they're in a holding pattern because we don't have enough vaccine. But as soon as we get that vaccine and start moving through the rest of the priority groups, will be contacting those individuals in multiple different ways to ensure that they know that they're eligible. And again, the thing that's most important too is if they miss it somehow, they don't miss it. They're always eligible to receive a vaccine. So we want to get those people, because they are our highest priority with respect to vulnerable population. We want to get them vaccinated as quickly as possible. But they never lose their place in line. They'll always have an opportunity to get it if they miss that first phase. But we're going to do our very best to ensure that we get all of them as we get vaccine delivered to the province.
Follow-up question, Adam?
What have we learned from other jurisdictions that are giving out vaccines in higher numbers right now about some of the hiccups they're running into as far as signing people up, contacting them, running the clinics? And second part of that question is, what are we doing to make sure that we're not putting stress on the healthcare system by using workers when the vaccine clinics do ramp up when we're still sort of treating COVID?
Okay, good question. I'll start, and then Derek, certainly, who's more linked into the immunization group, can talk about that. I would say I'm not sure what we've learned from other Canadian jurisdictions, if it was Canada, because we're all in the same boat with respect to available vaccine, and I think the rates of vaccination in Saskatchewan are some of the highest in the country, so I think there's some things potentially people could learn from us. But I think Derek might speak to some of the things that we've learned, but that is one of the things we've learned through lab testing and swabbing is make it as easily available to people as possible. Some people don't like booking appointments, so that's why we have so many mobile clinics and walk-in clinics and no-book appointments in the plan, because we want to make sure that everybody gets as much opportunity as they they can, including, hundreds of locations across the province. Derek, did you want to add anything on what we've learned from other jurisdictions?
Yeah, thanks, Scott. We are certainly looking to see what other countries are doing in terms of their immunization campaigns, be it on the booking side and how they're managing the scheduling and that logistical aspect. In addition to how are they operating drive-throughs and other delivery methods. So those are important to learn from. But I'll also say that just within Saskatchewan, we've been very effective in getting the shots into arms as quickly as possible when we receive it, as the minister mentioned earlier. And so we're continuously learning as a system as we roll out across the province in order to do it as efficiently and as effectively as possible.
Take our next question on the line.
We have Roberta Bell with Global.
Hi, my question is regarding testing, specifically in the north and far north. While in the south we're seeing, short wait times for testing, a few cars at drive-through, and an overall decline. We're hearing from people in the north that they're still having difficulty actually even accessing testing, that the availability is not there. Can you speak to this?
So, Derek, first of all, I'm not hearing those concerns at my level, so I would turn it over to Derek with respect to. Now, I will say, before Derek gets into this, one of the challenges with testing in remote locations is the fact that you've got to take the swab and transport it to one of the bigger labs to get done, unless it's one of those tests that's determined by a medical health officer to be of a priority. So, for example, a suspected outbreak, and as you know, we've distributed gene expert machines across the province, which are a quick PCR test, an accurate PCR test, and we have deployed in over 19 locations across the province and all over the north. So, like I said, I haven't heard any of those concerns come across my desk, but I'll ask Derek if he's heard anything coming up through the lab team.
Likewise, Scott, we have testing sites available across the north in different locations, and sustain that access for citizens. And sometimes there's a delay just based on transportation to get the results into the labs, but certainly work to prioritize that.
And I might just add into that our Minister of Government Relations is on weekly calls with the North, with the mayors, with the Indigenous communities to be able to connect with what's going on up there, what do they need, and how we can support them in that. I haven't heard this come across my desk, but we'll certainly follow up.
Follow-up question, Roberta?
What message would you have to people who may be experiencing this right now or be frustrated at the availability of testing in their rural or remote area?
I would ask them to, or the message would be, is touch base with us, the Saskatchewan Health Authority, to see if there are other avenues or other places that you could get tested. We want people to get tested as quick as possible if they're feeling symptomatic, or certainly if they've been in close contact, to make sure that they have access to those testing, and we'll continue to strive to get there. If there are some challenges or there are some spaces in rural or remote communities that are not getting it, we need to know about it, and we'll have either ourselves through the SHA, the ministry, or through government relations connect with these communities to make sure that they have access to testing as quickly as possible.
Take our next question on the line.
We have Lisa Schick with CJME.
Hi. My question is about kind of what's happening right now. We've been hearing that, for example, in Priestville, all 80-year-olds have their first dose of the vaccine, but meanwhile, other parts of the province, for example, in Swift Current, there aren't any doses, there haven't been any doses given out in long-term care yet. So why is this kind of a hodgepodge of different vaccines, and what do you say to the people who are in long-term care and saying, well, we need doses too?
Lisa, if we had an unlimited supply of vaccines, we'd be rolling out this evenly across the province. It would be everybody would be able to have access to this if we had unlimited supply of vaccines. We don't right now, so we've been targeting areas that have had some challenges in their COVID outbreaks, and some areas that have not. We've also had areas that the Premier has announced that have been scheduled to get vaccines that we had to pull back because our shipments of vaccines were not either arriving or they were arriving in different quantities and a lower quantity. So this is a challenge. This is going to continue to be something that we're going to work on to make sure it's as fair and equitable as possible across the province. But the real reason is because we don't have a massive supply of vaccines right now, and it's extremely scarce, and we have to target specific areas.
Follow-up question, Lisa?
Yes, I'm just wondering where all the people are going to be coming from to staff these immunization clinics. I think there's more than 140 mass immunization clinics in the plan. That's going to require a lot of manpower. Is this going to mean you're going to be taking people from other parts of the healthcare system? Are you going to have to shut some things down in the healthcare system to staff these clinics?
So no, throughout the pandemic, whether it's the offensive strategy, the defensive strategy, how we're building capacity to help with outbreaks both in our own facilities, long-term care and acute, but also our affiliates and partner facilities, and like immunization, we're not using the same resources twice. We've been building a labor pool to support our actions. We continue to build a labor pool specific to immunization, and as I said, we will be drawing on some non-traditional individuals to join us in immunizing residents across the province. But at the same time, it's important to note that the other work we've done, just like in contact tracing, where we took contact tracing from a historical way of doing business that was primarily responsible for a clinical individual, primary health care nurse to perform that duty, because of the need across the province and the importance of contact tracing to break the chain of transmission across the province, we split that now into 6 different functions, only 2 that require a regulated health professional to be involved, and we use resources from the Public Service Commission. We've used resources from Stats Canada to help support those non-clinical components of it, and we've provincialized some of that work as well so that we're much more efficient. We feel that we have the same opportunity with immunization, so the people that actually can put the needle in arms, that's what they're doing. They're putting the needle in the arms. They're not directing traffic. They're not managing the line. They're not managing the administrative responsibilities associated with it. So one of the things in the messages, I guess, Lisa, is we're not just drawing on our own teams. We're going to draw on resources across the province. We may be tapping on local businesses or security services or other organizations that we know are willing to help us, because we've had a number of organizations from across this province reach out and say we're willing to help.
Come back to the room. Arthur?
So it seems like June is the last kind of possible date that you put into this presentation for when we might be able to start phase 2. Why are you confident that you will have it by June? If things went really wrong, if there were some kind of manufacturing breakdown like we saw this past month, couldn't it take longer than June to begin phase 2 of the vaccination plan?
Well, again, it's very reliant on what we're getting, Arthur. It's a challenge to continually pivot on what we're doing. We wanted to have a window. We wanted to talk about what does this look like and how are we going to be able to do our vaccines. When the vaccines come is going to be the challenge, and when the age groups are called is going to be the challenge. We're very confident in this plan. We're very confident, and I'm extremely encouraged as a health minister that people are so interested in the vaccination process. That is very encouraging. And I'm glad that that is happening, and I want it to continue to happen. So we want to keep them as informed as possible, and we want to give them the realistic idea of when they could be getting vaccinated, and we have a window right now, and we're hopeful that we get more vaccines so we can able to accelerate that program. We have the capacity, and we have it built in. We can accelerate this if need be. So again, it's dependent on the flow of vaccines from the government.
And the only other thing I would add, Arthur, is that we know, and you'll see it, there's a reminder in the document online. I mean, the number of manufacturers that the Canadian government has contracted with, and right now, our assumption is we're going to be riding the Moderna and Pfizer wave, but we know that there'll be other vaccines available to us, and we can only prepare and act on what we hear. To the minister's point, is the federal government has to deliver what they say they're going to deliver, and we've got a prime minister that's telling us that everybody in this country will receive a vaccine that wants it by the end of September, and that won't happen if we get all the vaccine in September. So for us, like I said, we're prepared. It's all hands on deck, and we'll be ready to administer whatever amount of vaccine they give us as quickly as possible.
Follow up, Arthur? Mark? Perfect. Thanks, everyone. That concludes today's press conference.
Thank you.